Oh, yeah, we're good? Yeah. What's going on, Secoya Nation? This is Dr. Schilling bringing this week's Wednesday Wellness Minutes. And this week we're going to talk about dental health. Everybody has some pretty interesting misconceptions about dental health. So we want to kind of clarify some things for you in order to demystify the importance of your dental health. It's not just good enough to brush your teeth twice a day or floss once a day. A lot of people skip the flossing. Definitely do not skip flossing. Flossing is super important for you, but brushing twice a day is really good. But when you think about dental health, you got to think about it as an inside job. I know your teeth are inside your mouth and they don't really seem like they're inside your body completely, but the issues that the teeth have come from deep within. Okay? You can have an injury to a tooth or you can have a problem with a tooth, but what you really want to understand is there are far-reaching effects in the body that can affect the teeth. So let's just kind of talk about that. If you've never seen a tooth chart that shows you the connections between your teeth and your body organs, just type in Google Images tooth organ connection or tooth organ chart, and you will find something like this. This one has the bright colors on it. It doesn't need bright colors, but it's going to give you an idea of the effects. So for example, if you were like a lot of kids that fall out of their baby swing and hit their front teeth, and you maybe lose those, but they come back in as adult teeth and they end up being grayed or discolored and things like that, oftentimes what you'll find is that that's because the actual root of the tooth has been damaged and the nervous system has been impacted there. We would call that an interference field here in the clinic, but what you want to appreciate is that impact can have the teeth become a problem over time. It can work the other way as well. For example, those are the kidney-related teeth in one area of the mouth. And as a result, you can have kidney disease and end up having a problem with your teeth. So therefore, you want to appreciate that it works both ways. It could be the tooth, it could be the organ, and vice versa. And always remember, as we speak here in the clinic, no one thing ever causes any one thing. There's a multitude of things. Therefore, if it's not an injury, what you want to appreciate is it might be some other distant issue. It could be something as simple as a tailbone injury, injury to the head, an episiotomy, scar tissue from C-section, if you will. There are a lot of different areas, and you've heard us mention that in the past. But let's talk about tooth health. Teeth are basically bone. They're an extension of your jaw. So therefore, if you have any arteriosclerosis or atherosclerosis or any other arterial disease, any blood vessel disease in your body, those can ultimately affect the tiny, tiny little vessels that feed each one of your teeth. That's really important to understand for anyone who might be dealing with cardiovascular challenges. Bartonella is a really common bacteria that affects the teeth, but that's not the only one. Teeth can be very significantly affected by low levels of hydrochloric acid. Hydrochloric acid is in the stomach. If you took it out of your stomach, put it on your hand, it would burn a hole in your hand. It's really acidic. Not very good for you on the outside of your body, but it works fantastically on the inside. If HCl gets low, then another bacteria called Helicobacter pylori, or H. pylori for short, can increase its level in the stomach, which you already have it in there. Don't worry about that. It's already there. It just depends on if you have an issue with, well, let's say indigestible anger and frustration, for example. That can cause a problem in your nervous system, which can weaken the stomach and allow that bacteria to become more prevalent, bigger populations, and that can then raise the alkalinity in your stomach, which you want a really acidic stomach. You want to raise the alkalinity. So don't have to get too fancy, but H. pylori in your stomach can cause a problem in your mouth and your teeth. Similarly, Clostridium difficile, or C. diff, can cause issues in your digestive system, and that can start causing recession of your gum lines, decay of the teeth, and things like that. So these are some really unknown connections that people don't hear about when they go to their dentist. All they say is brush and floss and you'll be fine. But when you think about infections and injuries, these play a much bigger role in the health of your teeth and things like that. If you have a tooth issue, getting a root canal is probably not a good idea. It's a pretty standard process and pretty standard procedure for most dentists. But what happens is you drill down in there, and what you're doing is basically putting a Band-Aid on it or taking some black tape and putting over a red alarm sign. You don't want to do that. Do not get a root canal, okay? You'd be almost better off losing the tooth and getting it pulled than having a root canal, because you're just basically going to leave an avenue for different things to get in there by having that root canal done. They'll probably plaster something over it, like an amalgam or some other composite filling, but understand that certainly a root canal is not the preferred method of going. To that note, or to that end rather, pulling the tooth is not a guarantee that you're ever going to get rid of the problem in your tooth. If the tooth problem is coming from somewhere else in the body, as we mentioned, like in the kidney or in the digestive system, just by pulling that tooth doesn't mean that you've eliminated the problem. think of the tooth as the canary in the coal mine, the warning sign, the shot across the bow of the boat, if you will. It is just letting you know that there's a problem on the inside, okay? And it's manifesting on the outside. Let's see, what else? Digestive imbalances, kidney problems, parathyroid glands. Parathyroid controls your calcium levels in your body, okay? Calcitonin is a major hormone in your body. If you have a parathyroid issue due to heavy metals in the body or some other imbalance, what it can cause is an imbalance in your parathyroid, which of course governs your thyroid as well, but that can cause your body to not mineralize properly, and therefore even if you take vitamin D and K2, you might not be getting enough minerals. So we'll talk about some minerals in a moment. Dental bacterial infections, we talked about that. It could be some Staph salivarius, it could be Bartonella, it could be H. pylori and things like that. So you always definitely want to get checked on that. If you have a bone infection somewhere else in your body, it might be called an osteonecrotic lesion, is a fancy word for a bone infection. That can manifest in your teeth. It doesn't have to be in the mouth for it to be affecting. I just want to make that clear if you haven't picked that up already. A problem anywhere in your body can cause a problem in your mouth. And your mouth is like the first line of defense as far as your whole digestive system goes. If that bacterial environment is imbalanced, that will cause problems to the rest of the body. Some of the symptoms related to a common bacterial infection or a chronic bacterial infection are you could have recurrent pain in your arm, you can have something as egregious as cancer can develop. So if you don't know what your TMJ is, your temporomandibular joint here, that can be like chronically locked up, tight, clicking, popping, snapping, open lock, closed lock, things like that. That can be a symptom of a bacterial, or forget the bacteria for a second, any type of infection in the mouth, could be in the bone, could be in the teeth. And then of course we have headaches. Headaches are pretty common. So when the teeth reflex back into the jaw, they can affect the mastoid here, and this is one of our deep sleep point checks. So you can have headaches and also disrupted sleep because the gallbladder meridian, if you ever look up gallbladder meridian on a Google image, it'll show you like a ram's horn on the side of the head. So a tooth can reflex back into that gallbladder meridian and affect not only digestion, but also give you chronic headaches. It can be a real bugger. Contrary to most common beliefs in the dental world and in public health world, fluoride put in your water and in your toothpaste is not going to protect you. It does not do anything. In fact, you can get too much fluoride and it can be a toxin for your thyroid. It can be excessive mineralization on the teeth and things like that. So always understand that man does not know better than the body. Okay? Simply put, it doesn't matter if it's a dentist or a public health official, no doctor or no scientist knows better what's for your body than your body already knows. So you were not born with fluoride in your body per se. Fluoride is not going to be beneficial for your teeth. So take that fluoride toothpaste and chuck it, and if you can, only drink natural spring water. If you're going to drink anything like reverse osmosis water, you need to put minerals in there because reverse osmosis pulls all the water out of there, all the minerals out of there rather. So just keep that in mind. There's just some helpful tips. Depending on the level of issue you're facing, and this, we could talk about this for days. I mean, this is just scratching the surface of this. We could talk about different products like Dentivan. We could talk about HCl to boost your hydrochloric acid, digestive enzymes to help your periodontal or your gum tissues be healthy. If you have a dental injury, we use Medidental Pack. We can use Coral Legend or Intramin or Premier Greens to get the minerals back in your body and help keep those teeth healthy. We could balance the immune system against H. pylori, Bartonella, C. diff, whatever it might be. You can look at Renavin to support the kidneys. You can get CoQ10. I mean, the list goes on and on. The big takeaway here is just because you have a dental problem does not mean it's in the tooth. It can be in the tooth, but it does not mean it's in the tooth. We need to figure out where it's coming from. Is it in the tooth? Is it in the kidney? Is it in the bone? Is it in the stomach, small intestine? It can be anywhere. So that's why we use QRA, quantum reflex analysis, as well as the biofeedback testing with muscle testing and things like that to get that feedback back to me and or our team here to get that information about what is really the cause. As you can tell by now, if you've been listening, this is not a simple conundrum to be in. If your tooth is having a problem, it can come from anywhere in your body. So what we do is we figure out where the issue is, find the tooth, and then we track it down. So it doesn't matter if you're having liver, gallbladder challenges, your stomach, your pancreas, just look up a tooth chart, any tooth chart, and you'll get an idea. And then if you have a problem tooth, you can look right on here. A lot of people have trouble with their molars. A lot of metal fillings are put in their molars. And I'm not talking like the wisdom teeth. Most people have had their wisdom teeth out because, of course, they've been told it's crowding or going to be causing problems with their teeth and things like that. Look at this chart. Look at your in your mouth where it is, where your problem is, and then it's going to give you an idea of what's going on. Then you'd need some other professional to help you understand what is going on in that area, right? It's not just simply enough to say, oh, my front teeth were injured and they're all grayed or yellowed or discolored or whatever it might be. I must have a kidney problem. That doesn't mean you have a disease or pathology. Remember, diseases are just a collection of symptoms that somebody put a name on, right? So what you want to appreciate is that get a professional to help you understand what the root cause is, because as you can tell by now, there are a litany of things that can cause a tooth injury or a tooth issue or an infection or a tooth falling apart, okay? Let us know if this has been helpful for you. Let us know if we've helped you demystify the problems behind teeth. It's not as simple as just avoiding sugar. Avoiding sugar is a great idea. It goes without saying, but that's not the only thing. And dental caries, or dental cavities as they're called commonly, they're just a symptom of something else. So if you have questions about your dental health, let us know. We just did a post on Tuesday about biological dentistry. Tagged Tooth by the Lake in there, fantastic group to work with. Dr. Hatcher down in Egan, Dr. Not Young. There's one in Oakdale and there's one in Vadnais Heights. We interrefer with all these folks because they are the ones that are leading the new generation of dentists that say we need to be less archaic about handling our dental health. If you need a dental referral, let us know. We'll give you the information, the contact information, because I don't know it off the top of my head, but we'll provide that information for you. So give us a thumbs up. Please do us a favor and share this with your friends and family so that they become more educated and more empowered in helping themselves and tackling their own health, because there's so much misinformation out there and we're in an age of way too much information and way too much wisdom. So allow us to help you figure your challenges out. It's usually much easier than you think. Unless you've had it for 35 years, then it was probably going to require some more digging. But if you have a new injury or a new challenge that you're being faced with, we can usually, quote unquote, scrape the surface off and get to the root cause and help you attack that right away, okay? Let us know how we can help you in the future. Let us know what topics or ideas or questions or health challenges you have. Send us your health challenge. We will talk about it. We will give you information to help you feel empowered. Don't be shy. I mean, no holds barred. And there's nothing random about the body. If you think it's completely unrelated to anything, it's not. There is some root cause behind your health challenges. So challenge us. Provide us the information you need, your questions answered, so you understand your health, and we will give you the answers, all right? If we need to, we'll tell you to come in, but most oftentimes we'll at least get you to the point where you're like, oh, okay, it makes sense now. It doesn't have to be so confusing. But remember, there's too much information and not enough clarity as far as that information. So let us know how we can be of service, and we will look forward to seeing you next Wednesday for the Wednesday Wellness Minutes. See you guys.